Welcome to another exciting episode on Ayaba Moses Health TV channel. On today's exciting episode, I'll be talking about causes, signs, symptoms, and preventions of kidney failure. If you haven't subscribed yet, kindly hit the subscription button, like, comment, and hit the notification bell in order not to miss any exciting episode that will be coming your way. But before I talk about some of the causes of kidney failure, let's talk about what the kidneys do. The kidneys have several jobs. One of the most important jobs is helping our bodies to eliminate toxins or waste from the body. The kidneys also filter your blood and send waste out of your body through the urine. The kidneys are like bean-shaped organs about the size of your fist. They sit under your rib cage towards your back. Normally, people have 2 kidneys working or functioning, but some people can live as long as 1 kidney is working or functioning correctly. When the kidneys do not work effectively, waste products build up in your system or your body, which means your kidneys are failing, thus kidney failure. In most serious situations, kidney failure can be very life-threatening. Kidney failure, also called renal failure, means one or both kidneys can no longer function well on their own or independently. Sometimes kidney failure is temporary. Other times it is a chronic condition that can get worse slowly over a long period of time. Kidney failure may sound serious, and actually it is. But treatment such as dialysis and kidney transplant has helped many people with limited kidney functions to continue to live fulfilling life. So these dialysis and kidney transplants are helping people with end-stage renal kidney disease to live a fulfilling life. Let's look at some of the causes of kidney failure or renal failure. Sometimes kidney failure happens quickly due to an unforeseen causes. Sometimes the kidneys lose function suddenly within hours or days. When it happens like that, it is called acute kidney failure. This type of renal failure is often temporal. If it is left untreated, that is the acute kidney failure, it can lead to chronic renal failure. The most important or the most common causes of renal failure are diabetes and hypertension or high blood pressure. There are other causes, but these causes are the main causes of renal failure: diabetes and high blood pressure. Some other causes of renal failure may be autoimmune kidney diseases like lupus, nephritis, Goodpasture syndrome, polyarthritis nodosa, sarcoidosis. Don't worry about these big names. When we say autoimmune kidney disease, what they mean is that the body, sometimes when the body is fighting against infections or foreign bodies, they release what we call antibodies. These antibodies are supposed to identify and differentiate the foreign bodies from the normal cells or tissues and organs in the body. But in abnormal circumstances, when the antibodies begin to attack healthy body tissues, this is what we call autoimmune diseases. So when the body's antibodies begin to attack the normal healthy kidney tissues in the kidneys, then you begin to have autoimmune kidney diseases, and which can lead to renal failure. Certain medications like NSAIDs, what we call non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, can cause renal failure. These painkillers, what they do is that they reduce the amount of blood flow to the kidneys, resulting in potential kidney damages. Antibiotics like vancomycin and a class of antibiotics called aminoglycosides, for example, gentamicin, neomycin, amikacin, and so on and so forth, can also cause renal failure. Diuretics, a group of medications that are used to treat hypertension, for example, hydrochlorothiazides, furosemide, spironolactones, can cause renal failure. Long-term use of a group of antihypertensives called ACE inhibitors or angiotensin-converting enzyme inhibitors, for example, lisinopril and enalapril, can also cause renal failure. Then also contrast dyes, which are used in diagnostic tests, such as MRI or magnetic resonance imaging, like iodinated radio contrast, can also predispose an individual to developing renal failure. HIV medications or some antiviral drugs that are used in treating viral diseases or conditions can also cause renal failure. Severe dehydration is very, very important. Recently, there was a study developed or that Kolebu Teaching Hospital came up with, that a lot of people are getting or developing renal failure because of dehydration. How or why does dehydration cause renal failure? Water, in the first place, water helps the kidneys to remove waste from the body or from the blood in the form of urine. So severe dehydration or dehydration can cause a build-up of waste and acids in the body, and it can clog the kidneys. There is a tube that connects the kidneys to the bladder, and it helps the urine to be emptied into the bladder for us to be able to urinate. This is what we call the ureters. So these ureters will be blocked with muscle proteins such as myoglobin, which can hurt the kidneys. Urinary obstructions, which can be as a result of stones blocking the ureters as a result of dehydration, can also cause renal failure. Then also uncontrolled systemic disease or heart disease and liver disease can lead to the development of renal failure. Then also a familial history of kidney failure. If one or two of your family members or relatives have already developed kidney failure, then you are at a high potential of developing renal failure. Let's move on to some of the signs and symptoms of renal failure. If your kidneys are not functioning properly, you may notice some of these signs and symptoms. Mind you, some of these signs and symptoms are not exclusive to renal failure, but they are indication that you need to check your kidneys. The first sign you might notice as when you are developing renal failure is fatigue or extreme tiredness, or what we call easy fatigability, and you begin to experience shortness of breath. You might also develop an upset of stomach or vomiting. The upset of stomach is as a result of a condition that stems from renal failure because of the accumulation of uremia, what we call uremic gastritis. Then also you can also notice some confusion or trouble concentrating. You may also develop, or you might develop, edema or swelling, especially around your hands and your ankles. Some people also develop muscle spasms or cramps. You may also develop dry or itchy skin as well. Some people also complain of poor appetite and metallic taste of food. There could be also the presence of seizure or coma in severe cases if it is not treated in the long term. People also feel nauseated, and also there's also decreased urine output, although in some cases the urine output produced may be normal. So these are some of the common signs and symptoms you should notice so that you check your kidneys regularly. The last thing I want to talk about is the prevention of renal failure. As an adage goes, we all know that prevention is better than what? Better than cure. We should not or do not have to wait till we develop chronic kidney disease and end up having the end-stage renal disease or end-stage renal failure before we start taking care of our kidneys. In the immediate effect, some of the ways we can take care of our kidneys are by drinking enough water. So at least drink 8 glasses of water in a day. Stay hydrated. Drink enough water. Check your kidneys frequently as well. Don't wait till you are sick. If you are there, just pass by the hospital. Make sure you check your kidneys. Maintain a healthy diet, such as limiting your intake of food with high content of protein and salt. Make sure you cut down on some of these things. Do not take a lot of proteins and limit your salt intake. Exercise regularly as well. Make sure you reduce your weight. I've done a video on how to lose weight effectively. The link is in my bio. Kindly scroll down or scroll through my channel and then watch that video. Also, one of the ways you can prevent renal failure is by limiting your alcohol intake. There's a video I've done on the effects of alcohol and the damaging effects that alcohol contributes to our body system. Make sure you also watch that video as well. Avoid smoking. Smoking has been thought to contribute to renal failure. So as much as possible, avoid smoking. Avoid herbal supplements and medication. I understand some of these herbal supplements and medications have been approved by the Food and Drugs Authority, but those that are sold by the roadside, especially in the cars and what have you, please, as much as possible, avoid them. Before you take them, make sure you consult your medical personnel before you take these herbal preparations and supplements. Avoid taking over-the-counter NSAIDs or painkillers. As I've already said in the video, painkillers or NSAIDs can contribute to renal failure. So if you are experiencing any pain or any ache in your body, headache, stomach pain, make sure you go to the hospital. Let them prescribe the right medications for you to take. Antibiotics, the random and the rampant taking of unprescribed antibiotics, over-the-counter medication, should be stopped. We should put a stop to this habit. Antihypertensives, which are not prescribed by your doctors, should also be avoided. If you think your BP is high, go to the hospital. We'll put you on the appropriate antihypertensive medications for you. If you have been diagnosed of chronic kidney disease or chronic kidney failure, these are some of the things you can also do to prevent the end-stage renal failure. Make sure you check your kidneys regularly with your doctor. Make sure you go to the hospital. Keep your doctor informed with the test you do on your kidneys. Your doctor also help you to perform some of these tests. If you are diagnosed with diabetes, make sure you keep your blood sugar levels under control by taking your anti-diabetic medications, the prescribed ones, of course. Make sure you take them so that your blood sugar level will be optimum for you. Keep your blood pressure levels in normal range as well. If you have hypertension, by taking your antihypertensive medications, which have been prescribed. The key word is prescribed medications. So these are some of the ways to prevent renal failure. I believe you have been educated. So till I come your way the next time, kindly hit the subscription button, like, comment, and hit the notification bell in order to get updated with the new videos that will be coming up. Till I come your way the next time, stay healthy.